Hello, everybody, and welcome. Welcome to Elevate Wealth Advisory's monthly webinar series. Today, we're talking about managing your healthcare expenses in retirement with a big focus on Medicare. I'm Betsy Kenyon. I'm the marketing coordinator here at Elevate Wealth Advisory. If you're new to us, we are a wealth advising firm in Athens, Georgia, and we were founded in 1982 by Chuck Vickery with his goal of helping people make smart decisions with their money. So we're still doing that 41 years later. Just instead of a team of one or two people, we've now grown to a team of 10, and we're still growing. Before I introduce you to our speaker, which is our founder, Chuck, I wanted to point out a couple things. If you look at the bottom of your screen, you'll see both a chat box and a Q&A box. So if you have questions for Chuck throughout today's presentation, just put those in either of those places and we'll make sure they get answered. If for some reason, due to time constraints, we can't get to your question, we will go ahead and email you back an answer. And then if you think of something later you wanted to ask Chuck, just drop me an email at marketing@elevate-wealth.com and I'll make sure that we get your question answered. So now I'd like to introduce you to Chuck Vickery. As I said, he founded our firm in 1982 after serving some time in the Army and graduating from the wonderful University of Georgia. Chuck and his wife, Patsy, live here in Athens. And when he's not helping people make smart decisions with their money, you'll find him at a Georgia football game or probably playing golf. So welcome, Chuck. Thank you so much for once again hosting one of our webinars. I'll let you take it away.
Thanks, Betsy. Good to be here. Thank y'all for tuning in. They're asking me to do this because I'm the only person in our firm that is actually on Medicare. And so what we're going to do today is we're going to take a few minutes and talk about what baby boomers need to know about Medicare. So let's start by what is Medicare? Well, basically, Medicare is our national health insurance for people 65 and older. It's administered by the Centers for Medicare and Medicaid Services, and you enroll in it through the Social Security Administration. To be eligible for Medicare, you basically have to be a U.S. citizen at age 65 or been a legal resident of the U.S. for the last 5 years. And then some people that are on Social Security disability qualify. But for our purposes, we're going to talk about U.S. citizens age 65 and their eligibility. And when we talk about Medicare, there's 4 parts to it. You'll notice Part A and B are provided by the government, provided by Medicare. Part A takes care of the hospital. Part B takes care of the doctors and the testing and some miscellaneous things like flu shots. Parts C and D are provided with private insurers that have contracts with Medicare. And Part C is a Medicare Advantage plan, and Part D is a Medicare drug prescription plan. And these 4 parts are usually put together in one of 2 ways. The first way is what we call original Medicare. And with original Medicare, you have Part A for the hospital, Part B for the doctor. Those are for the government. Then you buy Part D from a private insurer to take care of your drugs. And most people buy a Medigap or Medicare supplement policy to fill in the gaps on things that Medicare does not cover. So that's sort of option 1. Option 2 is you go with a Medicare Advantage plan. And a Medicare Advantage plan is through a private insurer. These plans are like health maintenance organizations or preferred provider organizations in that they have a list of doctors and pharmacists that they work with. It does have Part A, it does have Part B, and it normally has Part D built into it. So there's a little bit of a difference here. One, you're dealing with the government, and you pretty much have no restrictions on who you can see. And one, you're dealing with a private insurance company, and you do have restrictions on who you can see. So how do you enroll? Well, hold on just a minute. We'll get our computer to work here. Here we go. Had a little technical glitch there. So how do you enroll in Medicare? Well, there's one basic principle of enrollment. Unless you are covered by an employer plan, an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. Now, if you're covered by a large group, it can be through your work or through your spouse's work, then you do not have to enroll at 65. Otherwise, you should enroll when you turn 65. If you don't enroll at 65, there are going to be late enrollment penalties. Your healthcare expenses probably will not be covered by insurance, and your private insurance options may be limited. So, how do you enroll? Well, if you are already receiving Social Security when you turn 65, and you can start Social Security at age 62, we don't normally recommend that in a lot of cases, but sometimes it's appropriate. If you're already receiving Social Security at 65, Medicare Parts A and B are automatic. You can decline to Part B if you want to wait for a while. The coverage starts the first of the month that you turn 65. Parts C and D are not automatic. Again, these are the parts where you have to choose a private insurer. And because of that, you have to proactively enroll in those parts. Well, how do you enroll? Well, if you're not receiving Social Security when you turn 65, then you must sign up through the Social Security Administration. And there's 3 different enrollment periods. One's the initial enrollment period, and that's for people that are not covered by a big group when they turn 65. There's a special enrollment period, and that's for people that are covered by a big group, 20 or more at age 65. And there's a general enrollment period, and that's for people that for some reason or another just fail to sign up when they turn 65. So if you're not receiving Social Security, you should sign up 3 months before you turn 65. You have 3 months. So if you've got a December birthday, this is now September. So you got September, October, and November. The coverage starts on December 1st. You can go ahead and enroll now. So as long as you enroll before you turn 65, the coverage starts on the first of the month you do turn 65. If you wait until your birth month to enroll, then the coverage is effective the next month. And if you wait until 1, 2, or 3 months after you're 65, then the coverage begins the following month after you enroll. So this is your window: 3 months before 65, 3 months after 65. So there's a 7-month window in there. I'd suggest you do it as early as possible, because you want to make sure you're not without coverage. So who signs up during this first period, this initial enrollment period? Well, basically, everyone who turns 65 that's not working for a big group. And even if you are working for a large employer, you may be advised to enroll in Medicare Part A to enhance the hospital coverage that's offered by your plan. Now, there's a caveat to this. Do not sign up for Part A or Part B if you're still working for a large employer and your plan is a high deductible health plan and it's paired with a health savings account. Because once you sign up for Medicare, you no longer can make contributions to that health savings account. Okay. So who signs up for Part B during the initial enrollment? Well, again, this is for people who are not covered by a comprehensive group health insurance plan with a large employer, 20 or more. So basically, it's people who are not working, who are self-employed, who are employed by a company with less than 20 employees, who are on COBRA, who are receiving retiree health benefits. Some companies let you retire and take your health insurance with you. So if you're on COBRA or if you've got retiree health benefits, when you turn 65, those become supplemental, and they supplement Medicare, and they sort of fill in what Medicare doesn't pay for. But if you don't have Medicare, neither COBRA nor retiree health benefits will pay anything. So you've got to be careful there. The same is true with companies with less than 20 employees. They may not pay after you turn 65. So it's important to enroll timely into Medicare. Well, who signs up for Part D during the initial enrollment period? Well, this again is the drug part of it. And people that sign up for Parts A and B normally sign up for Part D if you want to have drug coverage now or in the future. If you don't sign up when you're first eligible, you have to pay penalties not only for Medicare Part B, but also for Part D. So even if you're not taking drugs, you can find some of these that are very, very inexpensive, and you just need to go ahead and sign up for that when you turn 65. And there's two options. You can get a standalone plan, or you can get a Medicare Advantage plan that gives you drug coverage. So there's a special enrollment period. So we had the initial enrollment period. We've got the special enrollment period. This is for people who don't sign up when they turn 65 because they're continuing to work and because they're covered through their large employer's group plan. Well, when can they sign up? Well, they can sign up anytime before their coverage ends. If they decide they want to work until they're 70. Well, the month they retire, they can sign up for Medicare, and there's no penalties, and they're guaranteed they'll get the coverage. And they actually have an 8-month grace period that they can sign up in. So after they retire, they have 8 months to sign up. Don't recommend you take the full 8 months because that's 8 months without coverage. There's also a special enrollment period for Part D, and you can sign up for that anytime before the coverage ends, as your group policy ends. But here the grace period is only 63 days. It's not 8 days as with Part B. So if you wait longer than 63 days, then a penalty is applied, and that penalty is a lifetime penalty. You pay it the rest of your life. It's not just one and done. Okay. So the best time to enroll in Medicare is when you're 65. To avoid those late enrollment penalties, sign up during the initial or the special enrollment period. And to avoid gaps in coverage, sign up before your current coverage ends. And then if you happen to just go brain dead and you forgot to enroll in Medicare, there is a general enrollment period. And this general enrollment period is January 1st through March 31st. So if you turn 65 back in April and you have missed the 3 months after your birth month, you have to wait until next January to sign up. And then the coverage begins the month after you enroll. So January, February, and March is the special, or the general enrollment period for those that failed to sign up when they were 65, and the coverage starts the day after or the month after you turn 65. So just a review of the enrollment periods: initial enrollment period. If you're not working for a big company, sign up to 3 months before your 65th birthday, and the coverage begins on the first of the month that you turn 65. The special enrollment period is for people that are covered by a large group. You can sign up at any time, but the best time to sign up is before your coverage ends. And the coverage starts the first of the month of enrollment if you enroll within 1 month of following termination. If you wait up to those other 8 months, it starts a month after you enroll. And then the general enrollment period runs January 1st through March 31st, and it begins the month after you enroll. So how do you sign up for Medicare Parts A and B and these other things? Well, there's two ways you can do it. You can go online to www.ssa.gov, Social Security Administration.gov, and apply for your Medicare benefits. Or you can call Social Security, and here's the number, 800-772-1213. There's also, you can go online to medicare.gov/Medicare eligibility and get some general information. Now, I have never spoken to anyone at Social Security about Medicare. I did it online, and it was really quite simple once you get into it. So you can also go to medicare.gov and get a lot of questions answered and get a lot of information. So what you have to decide is, number one, do you want drug coverage? I recommend that you take it. Then you have to decide, do I want original Medicare or do I want Medicare Advantage? And if you want original Medicare, then you get parts A and B plus D, and you have to shop for that standalone prescription coverage. But you can do that at medicare.gov, or you can buy it from a private insurer. And most people that do the original Medicare also buy supplemental insurance, and the agent you buy the supplemental insurance from can help you with a drug part of it. If you want a Medicare Advantage plan, and you want to make sure you get it with drug coverage, and so there's a lot of ads on TV about these Medicare Advantage plans. So you can get one of those. And you get those, again, through a private insurer. So let's talk a little bit about these private insurers, because this is a government-funded program, and all of a sudden now we're talking about dealing with private insurance companies. Part B premiums are paid directly to Medicare. So a friend of mine turned 65, and his son-in-law said, "Man, you're so lucky. You no longer have to pay for health insurance." Well, that's not true. You do have to pay for health insurance, and Medicare is not free. And the Part B premiums are paid directly to Medicare. Part A premiums are paid by people that are working. So if you're still working, look at your check. And on the check stub, if it says Medi, and it's about 1.3% of what your pay is, that's who pays for Part A. But beneficiaries or participants pay directly to Medicare for their costs. Private insurance premiums for Part D, or for a Medicare policy, or for Medicare Advantage plan are paid directly to the insurers. And there are other costs that you have to come up with: deductibles, co-pays, portions of the doctor's bills that's not paid by Medicare, services not paid by Medicare. So sort of what's the cost of this stuff? Again, Part A is zero for most people. Part B changes every year, but for 2023, it's $164.90 a month. And then you'll notice here there's this income plus income related adjustment if applicable. And then Part D, the drug part is paid. The price varies with the benefits, and it varies with the plan, and it varies with the company. Plus, there's also an income-related adjustment paid to Medicare, if applicable. So basically, this is what I would call a Medicare tax for people that make above average incomes. So, and it's called IRMA, which is income-related adjustment amount. So what I'm showing you here are the premiums for parts B and D that are paid to Medicare. So you'll notice the first column says MAGI, that's modified adjusted gross income. And that basically is, take your tax return, that's your adjusted gross on plus any tax exempt interest that you've earned. And you can see single, it says up to $97,000. And then the modified adjusted gross income for joint is up to $194,000. And if you go over, you see Part B monthly premium paid to Medicare is $164.90. Next to it is Part B, income-related adjustment paid to Medicare. And you don't pay it if your income is at these levels or lower. And then there's a Part D drug plan, average cost $40. Some are more, some are less. And then Part D income-related adjustment. So the total monthly outlay per person at this income level is $204.90 this year. It'll probably go up next year. But look, if you make $1 more, just $1, and we'll take the married joint. If your income goes to $194,001, not only do you pay the $164.90, but you pay the $65.90 IRMA adjustment. You continue to pay the $40 for Part D, and then there's a Part D IRMA adjustment of $12.20. So the cost per person goes from $204 to $283. So you're paying almost $1,000. And if you're married, that's your $1,000 plus your spouse pays that as well, just for making that $1 extra. So here's what happens if you're retiring, and where they look at your last 2 years or your income tax return from 2 years ago. And the reason they do that, so let's say you got a March birthday and they want to know what your income was last year to see whether or not you need to pay this IRMA amount. Well, the tax return's not due until April and with an extension till October. So they go back an additional year. So for 2023, they're looking at your 2021 income to see if you're subject to these increased costs. And when you retire, if you've been making a substantial amount of money and you're going to fall into one of these higher brackets, then there's a form SSA 44 that you need to complete. So let's say you've been making $350,000. Well, based on this table, and you were married, the cost would be $519 a month for you and your spouse. But if you fill out this SSA 44, and you say, look, my income this year is going to be $180,000, then you don't pay the $500,000, you pay the $200,000. And that SSA 44, there are 8 things on there that are changes in your life, and one of them is work stoppage. So if you tell them, hey, I've retired, my income is going to be less, then they won't charge you the higher premium. So that's at the beginning. At the end of your life, this comes into impact you as well. You remember Betsy said we're a planning firm. So let's say that you and your spouse are retired. You're keeping your income under $194,000 so you don't have to pay this excess Medicare tax. And let's assume that your situation is such that at the first death, the only thing from an income standpoint that's going to be lost is one Social Security check, because when there's a couple and one dies, the survivor gets the higher of the 2 Social Security checks. So let's assume your income's $190,000. You or your spouse, one die, and the survivor has an income of $160,000. The problem with that is what we call the widow's penalty, because now that $160,000 income is not for a joint, but it's for a single. So if you can look at that first column and you go down to $160,000, then the Medicare cost goes from $200 to $500 a month. And that's why we call it a widow's penalty. So 2 great big, huge, humongous planning opportunities are when you first retire, to make sure that you do everything you can to avoid paying this excess penalty. And then during retirement, to have a planner, whether it's us or somebody else, that can work with you so that at the first death, the widow might not have to pay quite so much. And there's some things that you can do with Roth conversions by getting more tax efficient investments. Those are things that we help people with, and we'll be glad to help you with that as well. So does Medicare pay for everything? No, there are deductibles for Part A, there are deductibles for Part B, there are deductibles for the drug part. their co-insurance, it doesn't pay everything. You've got to come out of pocket for hospital stays. You've got to come out of pocket for doctor's offices. You've got to come out of pocket for money that's not approved. For the drug coverage, their deductibles, their co-pays, there's out-of-pocket money. So what it does cover is most of the hospital bill, but not all of it. 80% of your doctor's bills and services, and then some preventive services. It does not cover long-term care, care delivered outside the United States, dental care, vision care, hearing aids, cosmetic surgery, acupuncture, or other alternative care, amounts over Medicare approved, and amounts not covered by deductibles in the 20% co-insurance part. So the reason people get into private insurance is it will come in and fill in those gaps. It'll take care of your deductibles. It'll take care of the 20% that you have to pay on prescription drugs. Depending on how elaborate and how rich a plan you buy, you may not have a deductible, but so people use private insurance to supplement it because Medicare does not cover everything. And they do that with Medigap policies or Medicare supplement insurance. And again, this is private health insurance for individuals. It's sold by private insurance companies. It supplements original Medicare coverage parts A and B. And these policies have to follow federal and state laws that protect you. They're very standardized. One company can't out-benefit another company. They're in Georgia and in most states, there's Form A, B, C, D, E, so forth. The most comprehensive one that's available today is the G policy. And whether you buy it from Blue Cross Blue Shield, United Healthcare, United of Omaha, Wildlife of Texas, I don't care what the company is. The benefits are identical. What's not identical is the price. And what you want to do is find a good, strong company that will be here in years and years to take care of you. Our firm does not sell this insurance. We can assist you and discuss it with you, but we do not sell in health insurance. And if you get a supplemental policy, remember, it does not work with Medicare Advantage. Medicare Advantage is an all-encompassed program, and if you get a Medigap policy, it's designed to take care of those gaps in Medicare. Medicare Advantage is supposed to do their own thing. You do pay a monthly premium for these policies, and they do vary by cost, company, and location. So, but this is probably the way most people go. It's the original Medicare where you go with A and B and D, and then you get a supplemental policy. And I think it's the better way to go if you can afford it. There is an alternative, and it's called a Medicare Advantage plan. And these are health plan options provided by Medicare called Medicare Part C. Again, you're dealing with private companies. Medicare pays the insurer for each member they sign up. And it's about, I don't know the exact number, it's gone up some. I think it's in excess of $1,500 a month. So I was talking to a client recently, and she said those unemployed actors that are trying to get me to switch my Medicare around, that's the reason you see all these ads, is that for every person that enrolls in a Medicare Advantage plan, the insurance company gets $1,500 more a month. There is open enrollment coming up in October, where you can change yours if you're not happy with it. You can change your Part D in October if you want to. When you get into Medicare Advantage plans, as I mentioned, there is a network of doctors and hospitals that you use. Hopefully they will include prescription drug coverage, and they may include additional benefits like vision or dental. Benefits are different from each one. They're not standardized at all in Medicare Advantage plans. The nice thing about Medicare Advantage plans is they're cheaper. The disadvantage is you have to use their doctors, and while they may have a wide network of doctors, there may be times where you want to go to MD Anderson for cancer, or to the Cleveland Clinic to get your heart repaired, or some other place for brain surgery, John Hopkins or something for neuralgia. So different things. And you're not always allowed to do that with Medicare Advantage plans. The health care providers that we have as clients have all emphatically stated they do not want Medicare Advantage plans. Clients that have them complain much more about their health care and the cost of their health care than our clients that have the original Medicare and a supplemental policy. So shop carefully for these policies. So Medicare policies are standardized, but premiums vary considerably. So choose a policy that offers the coverage that you need, A through N. Choose a reputable company that'll give it to you at the lowest price. Make sure your healthcare provider possesses the billing for the company that you choose. The drug plan, choose a plan offering the coverage you need for the medications you take now. Again, that can be changed in the future. If you aren't taking any medications now, just buy the very cheapest one that you can find, because you're going to need to take drugs at some point in time. And by paying a little bit now, you can avoid those penalties later in life. And Medicare Advantage plans vary considerably. Choose the plan offering the coverage you need for the medicine that you take. So as we wrap this up, I've got a final word about healthcare cost. And it's, we spend on different things as we go through life. And we spend most of our money on healthcare as we age. So what we're seeing is that once you're on Medicare, the price is not frozen. We're having rising healthcare costs by higher insurance premiums, higher out-of-pockets. That 20% of a thousand is a lot more than 20% of 500 later on. A change in status may require, and health status may require, more expensive prescription drugs. And then there are services that you probably want that are not covered by insurance: dental, vision, hearing, long-term care is not covered. So you need to budget in increasing cost of health care. Fidelity did a study, and they said just out-of-pocket and premiums for a couple from age 65 through the death of both of them, it's $315,000. The Employee Benefit Research Institute broke it down even further. They said just premiums and out-of-pocket costs for men is $142,000 and $159,000 for women, $296 for couples. So your own customized needs may be different than this, but those needs are going to go up. And when you're planning your retirement, make sure you budget appropriately for healthcare costs, because it's not cheap, and it's going to get more expensive as we move along. And just keep in mind that long-term care is not covered by Medicare or by Medigap. And that number, the cost of long-term care, was not in those numbers I just gave you. What Medicare does pay for is skilled nursing care for 100 days, and that's it. So following a 3-day hospitalization, if a loved one has to go into a nursing home and they need skilled nursing care, then Medicare will cover it for 100 days. But after that, you're pretty much on your own. And if all you need is help with your activities of daily living, such as being able to feed yourself or take your own medicines or transfer, etc., there's no coverage at all for that. It has to be skilled nursing care. So let me leave you with 3 reminders. Number 1, enroll on time to avoid penalties and maintain coverage. Number 2, shop carefully for that private insurance to go with your Medicare. And number 3, plan for higher costs and retire. Thank you. I appreciate your attending today. If we have any questions, I'll be glad to do my best to answer them.
All right. Thank you so much, Chuck. You always do a great job explaining this to everybody. So
Thanks,
thank you. We do have a couple questions.
Okay.
What company is best in Georgia for Plan G supplement?
They're all the same. I mean, Plan G, whether it's Blue Cross Blue Shield, United Healthcare, United of Omaha, you just need to get in touch with an agent. And a lot of the agents that sell this represent more than one company. And I'm not even sure who the agents are. I just had a friend that was selling this, and I got him to be my agent. But I would just get somebody that compares 3 or 4 companies to you. If one is dramatically cheaper than the others, they're probably going to raise the price faster. So I would go with a rated, strongly, highly rated company that you feel like will be here when you need them in the future. That's the most important thing.
Okay, very good. At what age should you start looking into long-term care insurance policies?
Late 50s, early 60s is when you get the best price for that. And again, that too is going up with age, but it seems to be that that's the best time to do it.
Okay, very good. Those were our 2 questions. If anybody has additional questions, just drop us a line at marketing@elevate-wealth.com. And then I wanted to encourage you all to go ahead and follow us on social media. I'm going to share my screen, and this is our Facebook page. Oops, sorry about that. Here is our YouTube channel. Every week we're rolling out new content. This year we're focusing on investment tips. So you go to YouTube and look for us at Elevate Wealth Advisory in Athens, Georgia. And then you can also find us on our website at elevate-wealth.com. Here are links on the side. You go to resources. You can see our newsletters, our blog, and then you also can go here to attend our webinars. So thank you, everybody, for joining today. And next month, we're going to be focusing on long-term planning, or I'm sorry, end-of-year planning. Rob Fazekas will walk us through the deadlines for 2023 and give you tips on making sure you meet all those deadlines for your required minimum distributions, for HSAs, and more. So thanks always for joining in, and we'll see you next time. Thank you, Chuck.
Welcome, Etsy.